So, we're going to unravel a real medical puzzle today. It's a story about one of the most common life saving drugs in the world and how the key to using it safely is actually hidden deep inside our own DNA. So, the drug we're talking about is called Warfarin. You might know it by the brand name Coumadin. For decades, it has been the go-to medication for doctors who need to prevent dangerous blood clots in patients. You know, the kind that can cause strokes or blockages in the lungs. It's a huge deal in medicine. But it comes with a really big catch. And this image right here just nails the problem. Give a patient too little warfarin and you risk a devastating clot. But give them just a tiny bit too much and you could cause a catastrophic bleed, like in the brain. The line you have to walk is incredibly, incredibly thin. And that gets us to the heart of the matter, this dangerous balancing act that doctors have to perform every single day. You know, in the medical world, they call this a narrow therapeutic index. But honestly, the tightrope analogy is just perfect. It's exactly what it feels like for doctors. They're walking this fine line with every single patient, and the stakes could not be higher, especially in those first few weeks of treatment. So just how big is this variation we're talking about? Get this. It's a tenfold difference. That means one person might need only 1 milligram a day to get the right effect, while someone else needs 10 milligrams a day to get the exact same result. A 10 times difference. So, what could possibly cause such a huge swing? Well, for a long time, doctors knew about some of the factors. Things like your age, what you eat, especially leafy greens with lots of vitamin K, and other medicines you might be taking. And yeah, those things explain some of it. But the biggest piece of the puzzle, the real game changer that explains most of that 10x difference, turns out it's something we've only recently learned how to read, our own genetic code. And that is what leads us to the solution, a really revolutionary field of science that finds the answers not in a textbook, but inside our own bodies. The field is called pharmacogenomics. And the idea is actually pretty simple, but it's incredibly powerful. Our unique DNA is basically an instruction manual for how our bodies are going to handle medications. It's the blueprint for how you, specifically, will react to a drug like warfarin. So what this really means is that we can finally get away from that one-size-fits-all approach to medicine. Instead of just giving a standard dose and then hoping for the best through trial and error, we can look at a patient's DNA and get much, much closer to the right dose from the very start. This is what personalized medicine is all about. Okay, so how does this actually work in real life? Let's meet the specific genes that are at the center of this whole warfarin puzzle. It really comes down to two main players that are running the show. Okay, on the left, we've got a gene called CYP2C9. The easiest way to think about this one is as the body's drug cleanup crew. Its job is to break down or metabolize warfarin and get it out of your system. Then on the right, we have VKORC1. This is the drug's actual target. It's the enzyme, or the lock, that warfarin is trying to block to stop clots. And what's really fascinating is that different versions of these genes are more common in different populations around the world, which is exactly why a single standard dose is just bound to fail for a lot of people. So let's just focus on that cleanup crew gene, CYP2C9, for a second. Some people have a genetic code for a super fast, efficient crew. But other people, their genetic code gives them a crew that's, well, a bit slow. And if your cleanup crew is slow, the drug isn't getting cleared out. It hangs around and builds up in your body, meaning a standard dose could quickly become an overdose. So those people will need a much, much smaller dose. And here's where the drug's target, VKORC1, comes into play. Now, don't worry about memorizing all the details in this diagram. Just focus on the main idea. Your body has this process, the vitamin K cycle, to make the things that cause your blood to clot. The enzyme made by the VKORC1 gene is a key step in that factory line. Warfarin works by just jamming a wrench in the works. It blocks that enzyme. And genetic differences can make that enzyme either really easy or really hard to block, which directly changes how much drug you're going to need. Okay, so we've got the problem, right? And we've got the genetic reason for it. So now for the best part, the payoff. How all this knowledge is used to write a personalized prescription and get that dose right from day one. Because that's the key question, isn't it? How do you take all this complicated genetic data and turn it into a simple, life-saving decision for a patient who just walked into the emergency room? Well, the answer looks something like this. Think of this chart as the decoder ring for the whole puzzle. A doctor gets a patient's genetic test results for both the target gene, VKORC1, and the cleanup crew gene, CYP2C9, and then just finds their profile on the chart. So if you have the most common versions of the genes, you're a normal responder, and you start on the standard dose, say 5 to 7 milligrams. But if your genes make you more sensitive, you start lower, maybe 3 to 4. And if you have the sensitive variants for both genes, you're highly sensitive, and you need a tiny dose, maybe even less than a milligram. It just completely removes all the dangerous guesswork.
And when you do this, the results are, well, they're huge. Patients get to a stable, safe dose way faster. They have a much, much lower risk of serious bleeding problems. That whole scary initial phase of treatment just becomes a whole lot safer. It's a massive win for patients.
So where does this all lead? What's the big picture here? The thing is, warfarin is really just the tip of the iceberg. It's proof that this idea works, and it's paving the way for a whole new era of medicine. Okay, but let's be real for a second. It's not a perfect system. At least, not yet. We have to be honest about the hurdles. Genetic testing can still be pricey. Getting the results back can take time, and these tests just aren't available everywhere yet. Those are the real-world roadblocks we're still working through. But, and this is a big but, the technology is moving at lightning speed. The future we're moving toward isn't sending a test to a special lab and waiting days. It's a rapid test you can do right at the bedside that gives you results in under an hour. It's smart AI programs that look at your genes and other factors to predict the perfect dose, all built right into your medical chart. And that leaves us with a pretty wild final thought, doesn't it? The story of warfarin proves this is possible. So it really makes you wonder, how long is it going to be before having your genetic profile on hand isn't just for a few tricky drugs, but is a standard part of every single prescription a doctor ever writes for you?